A silent threat, 8 signs that could indicate heart disease. Heart disease, silently lurking in the shadows, is a pervasive health concern, often manifesting without clear warning signs. This insidious condition, characterized by a spectrum of cardiovascular problems, can have far-reaching consequences if left unaddressed. It's a global issue, affecting millions, often irrespective of age or lifestyle choices. Heart disease can stem from a variety of factors like hypertension, cholesterol imbalances, obesity, smoking, and even genetics. Neglecting heart health can lead to devastating outcomes like heart attacks, strokes, and chronic heart failure, severely impacting the quality of life and longevity. Moreover, heart disease can be stealthy, creeping up unnoticed until it reaches a critical point. This is particularly alarming considering the vast number of individuals who may be unknowingly living with underlying heart conditions. In this video, we'll delve into the 8 subtle yet significant signs that could indicate heart disease, signs that are too often overlooked or misinterpreted. We're not just listing symptoms, we're exploring their underlying causes, how they intertwine with overall health, and what they mean for your future well-being. Understanding these signs is crucial, as early detection and lifestyle modifications can dramatically alter the course of heart disease. By the end of our discussion, you will be armed with knowledge and the power to recognize these silent threats and the tools to take charge of your heart health. Join us in uncovering the hidden signs of heart disease, because your heart's health is the cornerstone of a vibrant, fulfilling life. Number 1. Swollen ankles, feet, or legs. Swollen ankles, feet, or legs, a condition known as edema, can be an early indication that your heart may not be functioning as well as it should. This swelling is more than just a temporary discomfort, it's a potential sign that your heart is struggling to pump blood effectively, leading to fluid accumulation in your lower extremities. You might first notice it as a slight puffiness in your ankles at the end of a busy day or a feeling of tightness in your shoes that wasn't there before. This swelling can gradually become more noticeable, persisting longer than usual and perhaps even extending upwards towards your legs. Edema in the lower extremities is often more evident when pressure is applied to the swollen area for a few seconds, leaving a dimple or indentation. It's particularly important to be attentive if you observe that the swelling becomes a regular occurrence, especially if it seems to worsen throughout the day. While swollen ankles, feet, or legs can be caused by various factors, such as prolonged standing or sitting, they warrant attention as a potential early sign of heart disease. Observing this symptom is a critical step in recognizing the silent messages your body is sending about your heart health. Number 2. Cold sweat. A cold sweat, a symptom often overlooked or attributed to less serious causes, can be a subtle yet significant sign of heart disease. Unlike regular sweating from exercise or high temperatures, a cold sweat related to heart issues appears without any obvious trigger and feels distinctly different. It's often described as clammy, cold, and unnerving. This kind of sweating happens when your body is under stress, and in the context of heart health, it's a response to the stress the heart is experiencing. When your heart is struggling to supply the body with enough blood, it triggers a stress response. This can lead to sudden, unexplained episodes of cold sweating, which might be accompanied by other sensations like dizziness or an unexplained sense of anxiety. It's important to be observant of when and how this cold sweat occurs. If you find yourself breaking into a cold sweat during times of rest, or if such episodes are accompanied by any form of discomfort or unease, it's a sign that should not be ignored. While cold sweats can occur due to various reasons, including hormonal changes or hypoglycemia, its occurrence without a clear reason can be an important indicator of heart issues. Recognizing a cold sweat as a potential sign of heart disease is part of understanding your body's unique ways of signaling distress. Paying attention to these signals is crucial in identifying the early signs of heart disease. Number 3. Pain in the upper abdomen. Pain in the upper abdomen, often mistaken for indigestion or a minor stomach issue, can sometimes be a more ominous sign pointing towards heart disease. This isn't the typical stomach ache or discomfort from overeating, it's a specific type of pain that can indicate something more serious. This pain usually manifests in the upper abdomen, just below the breastbone, and might feel like a pressing or full sensation that's hard to pinpoint. Unlike typical digestive discomfort, which often resolves with over-the-counter remedies or time, this pain can persist and sometimes feel like it's radiating to other parts of the upper body. It's important to differentiate this from common gastrointestinal discomfort. Heart-related upper abdominal pain often comes on suddenly and can feel more intense during periods of physical exertion or stress. It may not be as sharp as the pain associated with conditions like ulcers or gallbladder disease, but its persistence and the way it presents can be a key indicator of heart issues, particularly if it's accompanied by other symptoms like shortness of breath or nausea. While upper abdominal pain can be caused by a variety of factors, its occurrence, especially if it's unlike any digestive discomfort you've experienced before, should be noted as a potential sign of heart disease. Recognizing and understanding these subtler symptoms plays a crucial role in early identification and addressing heart health concerns. Number 4. Swelling of the face or abdomen. Swelling of the face or abdomen is a sign that is often overlooked, but it can be a critical indicator of heart disease. This kind of swelling, known as edema, is different from the typical puffiness one might experience from allergies or minor injuries. When related to heart health, it indicates that the heart is not efficiently pumping blood, leading to fluid accumulation in unusual areas, such as the face and abdomen. Facial swelling may present itself as a noticeable puffiness around the eyes, cheeks, or lips. It can be particularly evident upon waking up in the morning. Abdominal swelling, on the other hand, might manifest as a feeling of fullness or bloating that doesn't go away with regular digestion or passing of gas. This swelling can make clothing feel tighter around the waist and can sometimes be accompanied by weight gain that can't be explained by dietary changes. Both types of swelling are signs that the body is retaining fluid, a condition that can occur when the heart isn't pumping effectively, and blood flow slows down. The resulting backup of fluid in the veins can cause it to leak into surrounding tissues, leading to swelling. This symptom should be carefully observed, especially if it appears alongside other signs of heart disease. While swelling of the face or abdomen can have various other causes, including hormonal imbalances or kidney problems, its presence, particularly in combination with other cardiovascular symptoms, should not be taken lightly in the context of heart health. As we continue to unveil the signs of heart disease, it's clear that this silent threat manifests in ways we might not always recognize. We've explored 4 key indicators so far, from the swelling of ankles, feet, or legs to the unexpected episodes of cold sweat, the often misunderstood pain in the upper abdomen, and the more subtle signs like swelling of the face or abdomen. Stay with us as we delve deeper into the other signs of heart disease. Each one brings us closer to understanding how to better protect our most vital organ, the heart. Remember, detecting these signs early can make all the difference. Let's continue our journey to uncover the remaining signs and what they mean for our overall health and well-being. Number 5. Hair loss. Hair loss, particularly a sudden or unusual pattern of it, can be an unexpected warning sign of heart disease. While losing hair is often attributed to aging or genetic factors, when it occurs rapidly or predominantly affects the crown of the head, it warrants closer attention as a potential indicator of cardiovascular issues. This type of hair loss, known as male pattern baldness or androgenic alopecia, is linked to the presence of certain hormones and may correlate with an increased risk of heart disease. The connection lies in the similar hormonal imbalances and inflammatory processes that can affect both heart health and hair growth. In women, the link between hair loss and heart disease is less straightforward, but significant changes in hair volume or health might still be a clue worth noting. Sudden or patchy hair loss, which differs from the typical gradual thinning with age, could be a sign of underlying health issues, including those related to the heart. It's important to consider this symptom in conjunction with other risk factors for heart disease. If you notice a significant change in your hair's thickness or the pattern of hair loss seems unusual, especially if you have other risk factors for heart disease, it's a sign that should not be ignored. Number 6. Hearing loss. Hearing loss, particularly when it occurs gradually and subtly, may not immediately be linked to heart health, but it can be a lesser-known sign of underlying heart disease. This connection stems from the integral role that good circulation plays in maintaining healthy hearing function. The inner ear is highly sensitive to changes in blood flow. When the heart is not functioning optimally, and blood circulation is compromised, it can affect the delicate structures within the ear. Reduced blood flow can lead to damage in the inner ear, resulting in gradual hearing loss. This type of hearing impairment is often more pronounced in the lower frequencies and can be overlooked as a normal part of aging. While hearing loss can certainly occur due to a variety of reasons, including age, noise exposure, or genetic factors, a sudden or noticeable decrease in hearing ability, especially if it doesn't have an obvious cause, should be noted. This is particularly true if there are other risk factors for heart disease present, or if the hearing loss is accompanied by other symptoms like dizziness or ringing in the ears, tinnitus. It's essential to understand that hearing loss related to heart disease is often a gradual process, making it easy to miss or dismiss. However, paying attention to changes in hearing, especially when there are no clear external factors contributing to it, can be an important step in recognizing potential cardiovascular issues. Number 7. Cognitive changes. Cognitive changes, particularly those involving memory, attention, and problem-solving abilities, can be subtle indicators of heart disease. While these changes are often attributed to aging or stress, they can also be linked to cardiovascular health, especially when they occur gradually and persistently. The heart's primary role is to pump blood throughout the body, supplying oxygen and nutrients to all organs, including the brain. When heart function is compromised, it can lead to reduced blood flow to the brain. This diminished circulation can affect brain function, leading to noticeable changes in cognitive abilities. These cognitive changes can manifest in various ways, such as difficulty in concentrating, confusion in previously familiar situations, trouble remembering recent events, or taking longer to process information. While everyone experiences occasional forgetfulness, a consistent pattern of cognitive decline, especially if it's accompanied by other symptoms of heart disease, should be taken seriously. It's important to understand that cognitive changes related to heart health are not always dramatic. They can be subtle and gradual, making them easy to overlook or misattribute to other causes. However, if you or someone you know is experiencing these changes, particularly if there are risk factors for heart disease, it's a sign that should not be ignored. Number 8. Gum disease. Gum disease, commonly known as periodontal disease, may seem like an issue confined to oral health, but it can also be a sign of underlying heart disease. The connection between gum disease and heart health is rooted in the role of inflammation and the body's response to it. Periodontal disease involves inflammation and infection of the gums, which can lead to the breakdown of the tissue and bone that support the teeth. This inflammatory process doesn't just stay localized in the mouth, it can have systemic implications. Research has shown that the inflammation associated with gum disease can contribute to the buildup of plaque in the arteries, a key factor in heart disease. The signs of gum disease include swollen, red, or tender gums, bleeding while brushing or flossing, receding gums, persistent bad breath, and loose or shifting teeth. While these symptoms can have causes unrelated to heart health, their persistent presence, especially in conjunction with other risk factors for heart disease, should not be overlooked. It's important to note that gum disease is a preventable and treatable condition. Good oral hygiene practices, regular dental checkups, and addressing any signs of gum disease early can not only protect your oral health but also be a step towards maintaining your heart health. Having journeyed through the 8 silent signs of heart disease, from swollen ankles and unexpected cold sweats to cognitive changes in gum disease, we've uncovered the subtle ways our bodies might be signaling the need for attention to our heart health. These signs are often easy to overlook or misinterpret, but understanding them is a crucial step in safeguarding our cardiovascular well-being. But recognizing these signs is just the beginning. The next crucial step is understanding how we can actively manage and potentially reverse heart disease. It's not just about being vigilant, it's about taking actionable steps towards a healthier heart. In the upcoming section, we'll explore practical and effective strategies to manage heart health. These are not just preventative measures. Many of them have the potential to reverse the course of heart disease, offering hope and a path to better health. How to manage and reverse heart disease. 1. Choose high-fiber foods for heart health. Incorporating high-fiber foods into your diet is a key strategy for managing and potentially reversing heart disease. Why is fiber so important? It's because fiber, especially the soluble kind found in many fruits, vegetables, and whole grains, plays a significant role in improving heart health. Soluble fiber, when consumed, forms a gel-like substance in your digestive tract. This gel binds with cholesterol, helping to remove it from your body and consequently lowering cholesterol levels in your blood. High cholesterol is a known risk factor for heart disease, so keeping it in check is vital. But where can you find this heart-healthy fiber? Oats are a fantastic source. Starting your day with a bowl of oatmeal or oat-based cereal not only keeps you full but also contributes to maintaining a healthy heart. Fruits like apples, oranges, and berries are not only delicious but are packed with fiber. Including these in your diet, perhaps as snacks or in a fruit salad, can make a significant difference. Let's not forget about vegetables. Broccoli, carrots, and Brussels sprouts are all fiber-rich choices. Integrating them into meals, whether in a stir-fry, roasted, or as part of a hearty vegetable soup, is an effective way to boost your fiber intake. And then there are legumes like beans, lentils, and chickpeas. These are not only excellent sources of fiber but also provide protein, making them great options for meatless meals. It's important to increase your fiber intake gradually and ensure you're drinking plenty of water. Fiber works best when there is sufficient fluid, helping to avoid any digestive discomfort. 2. Reduce sodium intake. Reducing sodium intake is an essential step in managing and potentially reversing heart disease. Sodium, commonly consumed as salt, plays a significant role in heart health, mainly because of its ability to raise blood pressure. High blood pressure is a major risk factor for heart disease, as it forces the heart to work harder, potentially leading to damage over time. The challenge with sodium is that it's not just about the salt shaker on your dining table. Most of the sodium we consume is hidden in processed foods, restaurant meals, and even seemingly healthy options like some salad dressings and bread. The first step in reducing sodium intake is becoming aware of these hidden sources. One effective strategy is to prioritize home-cooked meals over processed or prepackaged foods. When you cook at home, you have complete control over the amount of salt added to your dishes. Use herbs, spices, lemon juice, and vinegar to add flavor to your meals instead of relying solely on salt. If you do buy packaged foods, read the labels carefully. Look for items labeled low sodium or no added salt. Even better, choose fresh or frozen fruits and vegetables, which are naturally low in sodium. 3. Incorporate heart-healthy fats. For years, fat was seen as a dietary villain, but the truth is, certain types of fats are essential for good heart health. These beneficial fats, primarily unsaturated fats, can actually help reduce the risk of heart disease when consumed in moderation. Firstly, let's talk about omega-3 fatty acids, which are found in fatty fish like salmon, mackerel, and sardines. These fats are champions for heart health because they help reduce inflammation throughout the body, a key contributor to heart disease. They also aid in lowering triglycerides, decreasing the risk of arrhythmia, irregular heartbeats, and slightly lowering blood pressure. Including fish in your diet a couple of times a week can provide these benefits. If you don't eat fish, consider plant-based sources of omega-3s like flax seeds, walnuts, and chia seeds, or discuss omega-3 supplements with your healthcare provider. Then there are monounsaturated fats, found in foods like olives, olive oil, avocados, and nuts like almonds and peanuts. These fats can help reduce bad cholesterol levels or LDL in your blood, which can lower your risk of stroke and heart attack. Moreover, they also provide nutrients to help develop and maintain your body's cells. Using olive oil in cooking or salad dressings instead of butter or other saturated fats can be an easy way to introduce these heart-healthy fats into your diet. It's important to note that while heart-healthy fats are beneficial, they are also high in calories, so moderation is key. The goal is to replace unhealthy fats, especially trans fats and saturated fats found in foods like fried snacks, baked goods, and fatty meats, with these healthier options. 4. Stay hydrated. Staying hydrated is a surprisingly simple yet crucial aspect of maintaining heart health. Water, the most essential element for life, plays a pivotal role in ensuring that your heart functions optimally. When your body is well hydrated, your heart can pump blood more easily, allowing it to deliver oxygen and nutrients to your cells efficiently. But why is hydration so important for the heart? The answer lies in the nature of blood itself. Blood is about 90% water, and when you're dehydrated, your blood becomes thicker. This increased viscosity makes it harder for your heart to circulate blood, potentially leading to an increase in heart rate and blood pressure. Think of your heart as a high-performing engine and water as its cooling and lubrication system. Just as an engine needs oil, your heart needs water to function smoothly. When you're well hydrated, your heart doesn't have to work as hard, reducing the risk of heart-related issues over time. Staying hydrated is especially important if you're engaging in physical activity or living in a hot climate. But how much water should you drink? While the 8 glasses a day rule is a good start, the actual amount can vary based on your body size, activity level, and the climate you live in. A good rule of thumb is to drink enough so that you're rarely thirsty and your urine is light in color. Incorporating hydration into your heart health routine doesn't have to be a chore. Keep a bottle of water with you during the day as a reminder to drink regularly. If you're not a fan of plain water, try infusing it with fruits like lemon, lime, or berries for a refreshing twist. 5. Avoid animal-based products. Avoiding animal products is a dietary approach that can have significant benefits for heart health. This plant-based strategy focuses on eliminating meat, dairy, and other animal-derived products, emphasizing instead a rich variety of fruits, vegetables, whole grains, legumes, nuts, and seeds. Let's explore why this shift can be beneficial for your heart. When you avoid animal products, you're essentially cutting out major sources of saturated fats, cholesterol, and certain inflammatory agents, all of which are linked to an increased risk of heart disease. Saturated fats, commonly found in red meat and full-fat dairy products, can raise LDL, the bad cholesterol levels in your blood, contributing to the buildup of plaques in your arteries. By reducing these fats, you can help keep your arteries clearer and improve overall heart function. Transitioning to a plant-based diet also increases your intake of fiber, antioxidants, and phytonutrients, all of which are heart healthy. Fiber, particularly soluble fiber found in foods like oats, beans, and apples, helps reduce cholesterol absorption and lower cholesterol levels. Antioxidants and phytonutrients found in fruits and vegetables help combat inflammation and protect your blood vessels. Moreover, a plant-based diet tends to be lower in calories, which can help with weight management. Maintaining a healthy weight is crucial for heart health, as obesity is a significant risk factor for heart disease. It's important to note that avoiding animal products doesn't automatically make a diet healthy. The key is to focus on whole, unprocessed plant foods. Refined grains, sugars, and processed plant-based foods can still be harmful to heart health. 6. Taking care of your mental well-being. Maintaining good mental health is an integral part of managing and potentially reversing heart disease. Often overlooked in the realm of physical health, mental well-being plays a crucial role in cardiovascular health. Stress, anxiety, depression, and other mental health issues can have a direct impact on the heart, influencing factors like blood pressure, heart rate, and overall heart function. When you're stressed or anxious, your body releases stress hormones like cortisol and adrenaline, which prepare your body for a fight or flight response. This response temporarily increases your heart rate and blood pressure, putting more strain on your heart. While this is a normal bodily reaction, chronic stress or anxiety can lead to sustained increases in heart rate and blood pressure, harming your heart over time. Depression is another significant factor that can affect heart health. It's not just a mental health issue, it can lead to poor health behaviors like smoking, physical inactivity, unhealthy eating, and neglecting medication, all of which can adversely affect heart health. Moreover, depression can directly increase the risk of heart disease due to its effects on the body's stress response and inflammation levels. So, how can you take care of your mental health for the sake of your heart? First, recognize the signs of stress, anxiety, and depression. Acknowledging these feelings is the first step in managing them. Regular physical activity is not only good for your heart but also helps reduce stress and improve mood. Activities like walking, swimming, or yoga can be particularly beneficial. Mindfulness and relaxation techniques such as meditation, deep breathing exercises, and progressive muscle relaxation can help manage stress and anxiety. These practices encourage a state of restfulness that counters the body's stress responses. Seeking social support is also vital. Connecting with friends, family, or support groups can provide emotional support and help you manage stress. In cases of persistent stress, anxiety, or depression, it's important to seek professional help. Therapists and counselors can provide strategies to manage mental health challenges effectively. Incorporating mental health care into your routine is as important as taking care of your physical health. By managing stress and addressing mental health issues, you're taking crucial steps to protect your heart and improve your overall well-being. Remember, a healthy mind contributes significantly to a healthy heart. And now I encourage you to share your experiences and thoughts in the comments below. Together we are winning health. I hope you enjoyed this video. Please like, subscribe, and hit the notification bell for more health-related videos. Thank you for watching.